Thank you, Jonathan. So first of all, I'd like to just begin by saying thank you to all my non-clinical and clinical colleagues for the tremendous work that they've put in over the last few months and almost 2 years, and commitment to continue to do so. And I hope that most, if not all, have had a summer break that has allowed them to rest and recover. So starting with COVID, we have circa 40 to 50 patients in the hospital over the last 2 weeks each day, with a split of around 30 to 35 in the John Radcliffe and 7 to 10 at the Horton. We have had patients in the intensive care unit in the last week, but currently, as of yesterday, we had one patient who was mechanically ventilated in the intensive care unit. Of course, what it means is if the intensive care unit is occupied by COVID patients, we have to eat into the capacity for intensive care for elective green patients. But safe to say that we have a CITREP that is formulated every morning, which tells us, and the intensive care teams are working together to make sure that the resource that's available is utilized in the most appropriate way on a daily basis. So that is good. Few really good pieces of news in the CEO report. So the Oxford Vaccine Group and the Jenner Institute won the Excellence in Healthcare Award in July, obviously for the reasons which are well known to everybody, which is fantastic position to be in. We also had our CQC report into infection prevention and control released in July following a visit in May. And the chief executive, Bruno Holthoff, did send a personal message to all staff after the CQC report was published, thanking them for their approach. The CQC highlighted many positive areas, and in particular, the skills and abilities of the IPC, infection prevention control teams, and made a positive note that the leaders operate effective IPC governance processes and the trusts have an open culture so that patients and staff can raise concerns about infection control without fear. There were some minor improvements to make, and I'm pleased to say that the teams have already acted on those. In case during COVID, another bit of news is that we continue to perform kidney transplants, and we have actually performed more kidney transplants in 2021 than in 1920, which is a tremendous achievement. Obviously, all these transplants go through the Churchill Hospital, which we have tried to keep green as far as possible. We also have good news for our tiny patients from neonatal and pediatric intensive care, where we have new modern ambulance services for them between us and Southampton, University Hospital Southampton. And these are really good new ambulances. This was a risk which we had for a few years, and I'm thankful for Jason and his team to working with our clinical teams in achieving this excellent news about new ambulances. We also have ANPR now finally in place, which I know Bruno would have been very pleased to report. So this is for our staff, for our visitor car parks at the Churchill and the John Radcliffe, which will be very, very handy for everybody who is in those car parks. The last bit of news really is that our BRC application, which is the application for the 4th round, has successfully gone through stage 1. And we're now preparing for the stage 2 application. All our 15 themes went through, which is fantastic achievement. And the committee noted that we have a very strong application, but also noted that we have a large number of themes, so have 15 themes across a broad range of areas. And really what we will now work with the BRC steering committee is to really show that golden thread that flows between all these themes to achieve the combined aims of the NHS and the university, to be able to detail the governance and oversight of these themes across the partnership. So that's what we'll be focusing on now. Just to note that we had 20 themes in the previous BRC round. We're now 15, and actually the other BRCs have a similar number of themes too. So we feel very positive about our application, which will be going forward to stage 2 in October. And the very last thing to update the board about is you would have read in the news about the shortage of blood tubes. And we nationally and regionally and locally, we have worked very well and made sure that the supply chain has held together in terms of supply to primary and secondary care. And we have sent messages to clinical teams about reducing unnecessary blood tests. And we have achieved a little drop in demand, but actually we haven't. The more important thing to say is that we haven't run out, and that has been managed well by teams. And finally, the last bit is about visiting. So and the other requirements on NHS sites, particularly ours. So we continue to maintain social distancing on all our sites, along with use of face masks and the other measures such as Clinell wipes and hand washing. The visiting rules remain the same, which is the rule of one. However, of course, there are exceptions for patients who are at the end of their life, so end of life care patients, and also for maternity, of course, where partners are allowed for scans and birth and postnatal visits. So I'll stop there, and I'm happy to take questions.